first, let's do like a quick, not review, but basically let's talk about what we did last time.
Okay, great. So I was able to work on my scalenes for like 3 days in a row.
Yeah.
Just kind of really taking it seriously and trying to find every single tender point I could and working at it. So those are way better. And, you know, that's a first. So I guess we also worked on infraspinatus, and I found, actually funny enough, a park bench where, you know, at the park that I run at, and it perfectly lined up with the spots I needed to hit. So I would just do some active release with that.
Yeah.
And that worked. I think still to this day, they're not too tender. So I'm going to try again today, actually, when I go run. But then, you know, I had overall a lot of improvement, and coracobrachialis, I can't really feel, you know, much tenderness there.
Yeah.
So
it may not be the issue.
Yeah. So the main thing now is that I'm wondering if it's my front delt. And the reason why is I'll just do this a little bit.
Yeah.
And it's like instant relief. I don't understand it, how that's possible. So yeah, lots of improvement regardless, especially in
So where was the pain at on a regular basis? 10's hospital, 0's no pain.
I mean, if I move my arm just right, like a 5 or 6.
Okay.
Now like a 3.
Okay, so yeah, like a 2-3 point pain reduction, like not even hands on, is awesome. That's a good sign. And normally if people reduce that much, if you keep working at it, it'll likely reduce just a little bit more. But I'm interested in this shoulder thing. You're reaching like right up here. Do you find that the anterior scalene is getting into that at all?
Yeah, I mean, it definitely, when I had the trigger points there, I could feel the pain in that area. So it's less painful now for sure. The reason I'm grabbing there is because it's kind of a tick at this point, but there's like a right here, in here, I can find that little spot. And I think it's one little trigger point or something, or scar tissue, but I found I had an old World War II 50 cal bullet cartridge, actually, just that I bought for novelty, and I pressed it in there and kept pressure, and I was able to find that trigger point. So in person, maybe you can manipulate that better.
Yeah.
Because I can tell you that this shoulder, if I do this and kind of pop it out of socket, nothing. I don't feel any sensation at all. But here, I mean, it's kind of impossible. I don't know if it's because I've been working on it so much and I just need to give it a few days, perhaps.
Well, soft tissue takes time. It's not something you really want to fight yourself. It's just slow growth, and we may find other muscles are like, you know, causing issues. Some of the ones that might be involved, if you've got pain up here, it might be like your subclavius, which is right underneath your collarbone. It might be your pec or pec minor, and it's like they're not impossible to work on yourself, but it's a little more challenging.
Yeah, because you gotta, you know, I'd have to do this or something, or
we'd have to figure out like almost like a small basketball or something that you'd put on a wall and like lean in to be able to address, like the pec minor in particular is really problematic. But you know that bony knob right here?
Yes.
Like if you follow your collarbone out and you'll hit the coracoid process, this little bony knob right there. That little bony knob is where the pec minor attaches, and it goes into a little 3-band thing. They're like the 3rd and 5th rib, I think. It tends to pull the shoulder blade forward. That little bony knob connects to the shoulder blade. It's just like a little piece. Coracoid process. Coracoid, I think, is Greek for like raven's beak or something like that. It's some kind of bird. It sticks out. So it's actually part of the shoulder blade, but what happens is if the pec minor gets really short, it tends to pull the shoulder blade forward. So the shoulder joint winds up being like in a weird, like not anatomically neutral position. So that's why shoulder problems, I think, are so complex. Like, it's challenging to figure out what the problem is. And if they develop a problem in one muscle, they tend to have a cascade. They'll develop, an issue with infraspinatus and their teres group and subscapularis and other muscles as things like progress because they had a challenge with one muscle.
Okay, so I did, after our consultation, I treated the scalenes and everything, treated my front delt, treated coracoid or the coracobrachialis, and then my infraspinatus. Multiple times in the past like 3 months, I've been able to achieve zero pain in any direction of my shoulder, but it only lasts for a couple days.
Yeah.
So that's confusing to me.
So the question as to why, like in my case, when you go down to a zero, it means that there isn't necessarily some sort of structural damage. You don't need surgery, whatever.
Oh, good. Okay.
There's some sort of soft tissue thing. Why it doesn't like just stay gone. The other issue with the shoulder joint is like we're using it constantly. So like I'm a body worker. I've had shoulder problems and I have to continue to work on my left side because I have issues on that side. I'm left-handed. So I'm left dominant, but I'm still using my arms working on people. Just when I'm working on clients, like when I press onto my rotator cuff over here, when I press on this and I'm like, oh, I'm going to work on the client. That muscle is like contracting and relaxing and contracting and relaxing. Your body's trying to maintain homeostasis, and it's like people's bodies just respond differently. Sometimes I wish body work was one and done, but a lot of times it's just maintenance, particularly if we develop like an ongoing issue.
So you said the fact that I reached a zero a couple times isn't just, I mean, that's not just in my head, is it?
No.
And it's also a good sign that, for example, I was worried I tore my labrum.
Nope. Yeah, I'm not. So the thing is, I'm not medical advice. I don't want to tell you no.
Yeah, of course.
But at the same time, when you drop to an absolute zero, well, at least you're not in any pain. If you're not in any pain, let's say you had a torn labrum. Okay, you might be able to go the rest of your life and have a torn labrum and have no pain at all. Now, I don't know if that's actually possible, but it also depends on the degree of the labral tear. Does it make sense?
Yeah, but I guess it's a positive that at the very least that I saw the pain go to zero.
Yeah. Now, I'm almost positive on my shoulder I've had tears. To this day, I'm not exactly sure of what. I suspect I have torn some muscle in various rotator cuff muscles, and I suspect that I have damaged some of the ligaments that keep my shoulder in joint. So when I damage those ligaments, the muscles work overtime trying to hold my shoulder in socket. Makes sense? Trying to keep the humerus in the head of the shoulder. But if I work on the tissue around it, I don't have any pain.
Okay.
I'm not doing like crazy weightlifting, so it's not even that big a deal. My body just compensates for it.
Yes. Okay.
Yeah.
Makes sense.
Yeah.
So yeah, I'll keep you posted. Right now, I gotta give myself a few days after treating it one night. It's tempting to do it every night, but I think that's maybe hindering my recovery sometimes.
Low and slow.
Okay.
Yeah. Like, in other words, because when we talk about working it, let's say you're going to work the scalene. If you're watching a movie and you just reach your finger up and you're going to work on it for a minute and then go about your day, that's just not that intense. But sometimes those incremental gains, kind of like working out, I think body work is similar.
Well, I mean, I'm definitely not in the same pain, regardless of how I think about it, that I was even 3 months ago, I guess. To say that, I mean, at the very least, I've improved. For example, this motion here with my thumb up used to be painful.
Yeah.
Just constant. There was no way that I couldn't, that didn't hurt.
Yeah.
And specifically, I guess right here. And, I've had an MRI and I don't have tendonitis or anything of my biceps tendon. So I thought it was soft tissue. At the very least, I've improved that way.
Yeah.
I guess on the zero pain days, it was kind of interesting to be able to do this movement and feel nothing.
Yeah.
So that was novel and amazing. So
yeah, I see a lot of, over the years, I've seen a lot of really debilitating pain issues. The clients are worried they're going to have surgery. They're worried they're going to be in pain for like the rest of their life. And I say something brilliant like, it seems like you have tight muscles.
yeah.
And in the end, you know, what the people feel is what they feel. Like, it doesn't matter to me exactly where. I just do my best to try to decrease their pain and make life more manageable. And in many cases, you know, I've seen people who are like, they're an 8, 10 is a hospital, they're an 8. And I'm like, how long have you been in an 8? And they're like, oh, 2 years. And I'm like, oh man, like pain levels that high are almost to the point of like opiate abuse, because this daily life is not relaxing at that point. So what I do is, if I work on them and all I do is reduce them to a 6, their quality of life goes up. And here's the thing, if they go to a 6, what I tell them is, listen, we could do it repeatedly. I can show you how to work on yourself. And in my experience, people drop not to a 6, they drop lower to a 4, to a 5, you know, whatever. Sometimes I work on people and I've had, you know, I've seen like a 6-point pain reduction in like a single session, and they just can't believe it. But it's just like this. If you were working out and you were like bicep, curl, bicep, and your bicep said, nope, and it shut down, what it seems to me, in my experience, to feel like is the way that the bicep gets you to stop doing that is the muscle shortens and says, we're not going to lengthen again.
Yep, cramps almost.
We're gonna prevent an injury by shutting down. And the shutting down is by shortening the muscle. And here's what happens. They'll come to me and go, man, my arm is killing me. And I go, where? And they're like, right here. My whole job is to feed an input into their nervous system, provide a stimulus, and somehow that links to their brain through cutaneous and subcutaneous nerves. And they go, oh, wow, that muscle's like, and it lets go.
Yeah.
When the muscle relaxes, that's when they seem to get the most pain relief. But I also find I can't force it. It's not about how sharp I press. It's not about how deep I press. It's about whether it's engaged and feeds back to their nervous system to go create safety. Like the muscle says, no, they're going to injure us. We don't want to do that again.
Yep.
But if I provide a stimulus that says it's okay and provides safety, the people relax and unwind. And sometimes it almost seems magical. Yeah.
Yeah, definitely. And I'm going to try to give this a break for a little, but I think I'm close. So that's exciting at the very least that I'm getting there. So.
So for today, like you can go ahead and just keep working on the shoulder. I don't want you to worry about injuring yourself if you work it daily. In my experience, what happens is it'll slowly kind of dissipate. And then maybe you start off working on it daily, then you switch to every other day, then it's only once or twice a week. I think that's totally fine. You can always go back and use the tools when it's necessary if it ever gives you issue. You were telling me that you kind of wanted to work on like your lower body today. It sounded like your ankle.
Yeah. So, and thanks for the explanation on the shoulder. Appreciate that. So I guess I'm also a runner. So I have put in a lot of miles in my life, been running for like 15 years now. And basically I was running maybe three miles a day for a few years, maybe 6 at most, sprinkled in there. Pretty fast, but never had any issues because it was just, you know, I wasn't doing super long distances. And about a year ago, I jumped up to 6 to 9 a day really fast, which I had the muscle memory for it so it didn't feel too bad. But, you know, I was ignoring pain in my calves and stuff. And basically at the end of that 6-week period where I was ramping up the miles really quickly, I started feeling foot pain, like here, in my arch.
Yeah.
And then also here in my ankle. So I started researching it immediately and saw that I might have posterior tibialis issues.
Okay.
and that didn't shock me at all because I had extremely painful, what is this,
You gastroc?
yeah,
Yeah.
that was really painful constantly, and I would just treat it when I got home every day, and it was enough treatment to be able to keep running. But I'm suspecting that I have soft tissue problems because they're just too tight for me to be able to treat easily at home, I guess.
Yeah.
But I don't know the leg muscles that well, but
So we're gonna do some exploration real quick. We're gonna move around in this. I'm gonna see if I can change this camera angle so you can see this. I think I'm gonna use my left leg here, and I'll get a blanket just so I can see if I can make this comfortable. I'm gonna pull my leg out here, and then what I want to be able to do is like your tibia, the bone is right here. I want to be able to press in the soft tissue right next to it. And I want to start to like press in here and see like how this feels. Like
so actually, oh, sorry.
So I'm pressing, like along the calf. I'm working through here. And for me, what I notice is if I'm up near the tibia, like the tibia is bone, like there's not a lot there. But for soft tissue, if I'm right next to it, I start to get a little activity, like I can press in here and I start to feel it like run down.
Yeah, I actually tried that for, only once. I was wondering what that was.
Yeah.
I pressed right next to the bone and I was able to recreate a lot of different pain I had. So yeah, I guess I never understood how that was. I don't know if
I mean, what it amounts to is like, I can't really do like a movement assessment of like your gait.
Yeah.
But the part of the issue is it's like when you run, I'm just going to ask you some basic questions. This is also giving people at home like a little bit of an idea of the stuff that I see. So I'm not much of a runner. I didn't like it in school.
Yeah.
I got some Vibram 5-finger shoes at one point and wanted to try because I had read information about barefoot running. When you run, do you run and hit your heel and then?
No, I don't anymore. I kind of run midfoot.
Do you have like minimalist shoes?
No.
Okay, so here's what I found. When I put on those Vibrams, I could run on concrete, but I ran on the ball pads of my feet. The challenge with that is my calves have to work overtime because my calves are acting like shock absorbers. Instead of just hitting and then running and hitting and running, now, yeah, I might feel like a gazelle, but whew, man, did it do a number on the muscles back here. What I notice is people who are having problems, especially, they'll come to me and tell me they have plantar fasciitis. They're having like inflammation at the bottoms of their feet. A lot of times what I find they're having issue with is typically soleus. Soleus is underneath the gastrocs.
Okay.
The gastrocnemius, gastro is from the same Greek root as like gastrointestinal bellies. But the soleus to me is the big workhorse. It's a muscle that's underneath the gastrocnemius. So that's the superficial layer. Those are the gastrocs. I could see those on you. And then that deeper muscle that you're maybe having an issue with is soleus. Soleus is the big workhorse in the lower leg, in the posterior side. So I can show you how to work on that. What I notice is people will wind up having issue. They'll say they feel it like in the bottoms of their feet. They'll say they're having issue with that. They do this all the time. I have plantar fasciitis. And then I'll take them and work on them. And I have to go very slow to try to work on this part of the calf, this posterior piece. And it's not just like moving it around and applying some sharp pressure. It's really broad, sustained compression that seems to help through there. The other thing is, have you worked on the feet themselves?
So I worked on, I don't remember the name of the muscle, but this one that causes pain here.
Yeah.
I have worked on that. I've like used the pen before and just put some pressure for a few seconds.
Yeah.
And felt relief quickly. So
Okay.
Just this one. I think it's there, right?
Yeah. So you said earlier you have a foam roll available, right?
Yeah, I found it
Okay.
now.
Yeah, go ahead, grab that foam roll. I'm gonna pull this guy over and see if I can show this on camera. I'm on my mat, so I have a little bit less pressure. Like the mat has a little bit of give, but I'm gonna change this out and show real quick. So what I wind up doing if I do have a problem with this and decide I want to work on it, both the gastrocs and soleus, and I'll show those again real quick. So soleus is the deeper muscle. This is the one that, in my opinion, we're really trying to get to.
Okay.
But it's also the more superficial gastrocnemius. These two muscles are in the posterior, so they're a little challenging to get to, and I can probably show you just a couple of quick ways that I think you can address it. So one, if I need something broad, this foam roll is much broader than, say, my elbow. I can also position it in a way to be able to, like, start to get into that muscle. I'm not pressing behind the knee. I'm just trying to get into that. Now, if I get to a spot and I'm like, ooh, right there, there's a difference with my foot between lengthening the muscle and then allowing it to rest. When I allow it to rest, it's tender. And then for me, I can roll my leg back and forth and start to rock that open a little bit.
Like this.
What I start to feel is this broad kind of sensation down towards my heel. Like it feels like it wants to go and wrap through my foot.
Is this proper?
How does it feel?
Ropey?
Ropey?
Like everything's tight.
So does it feel important?
Yeah.
Okay. Do you need more pressure?
I think so.
Okay.
The right side.
That's exactly what I was going to do. I'm going to see where we're at. I don't think I can kind of see it there. What I'm going to do is put the other leg on top, and then this leg is just going to be dead weight. Now, if I want more, what I can do is I put my weight into my hands and lift my body.
Okay.
Oh, eek. Oh.
Yeah.
Oh.
It's painful.
Now, what I can do is that leg, the where I'm pressing into the gastrocs and soleus, I can start to, man, I got to back off for a second.
Yeah.
Because I'm shortening and lengthening that muscle, moving it around while there's that force. That's going to work really, really deeply and allow you a passive way of accessing it. Do you feel like if you were to use your fingers, for instance, do you feel like you need to go higher or you need to go lower?
I guess I would say a little bit higher if I'm on the back of the leg.
Okay.
And then the lower I get.
You have a tennis ball available?
Yes.
Okay. So this one's a little bit more complex, but I think this is going to help you with some of the pressure. So I'm gonna turn this way. They can probably see this pretty well. Let me see if I flip between these cameras, if this shows up. Yeah, that does pretty well. You got your tennis ball?
Yep.
Yeah. So what I'm going to do is I don't want to press in the back of the knee. I want to press into my hamstrings and I want to press into the gastrocs and the soleus. Now I can find the spot and go, okay, right there. And then what I'm going to do is I'm going to use my upper leg to pin. Oh,
I never thought of that.
To try to pin that muscle right in there. So it's on my right leg right now. You can probably see this here Oh, now my hamstrings feel like they just kind of slide out of the way, but that pressure, like I'm getting a referred thing like down here on the outside of my foot right here. Like I feel a sensation right there from that pressure. This is also a great because it doesn't like strain my hands. If I need to move it, I can always move it just a little bit higher or a little bit lower, depending on what I feel and depending on the size of my calves.
Okay. And I can go all along the width of the calf.
Say it again.
I can go all along the width of the calf doing that.
Yeah, there's nowhere in here, in my opinion, so long as it's not painful, you're not going to do any damage. It doesn't matter if you go further down. You don't want to put like extreme pressure right into the Achilles tendon right here at the back. You might want to come a little bit higher where there's muscle. And usually that's where people seem to get the most benefit in the shortest amount of time.
Well, I can feel some slight releasing, or, you know, the starting of it, that when the muscle starts kind of wavy feeling. I do feel that a little bit, actually. So
yeah,
that is really easy.
yeah. And the thing is, it's two quick ways, right? Now, let's say you built up to the point, because I'm going to show you a third. This is the same basic thing, but golf is very mean. That does not have much give, but it's much more pointed, kind of like an elbow. So the deal is you could use that in the same way you use the tennis ball. It's just that this is more precise and I think a little more angry. What I do is give you a broad way with the foam roller and then give you something sharper to continue working on it. You may find that the tibialis posterior, which you mentioned, and you may find that the soleus are causing issues, but mainly what I see in most cases, people are working on the gastrocs, which are more superficial, and then they're working on soleus.
So I guess on my right leg, I'm kind of putting the ball here. If I were to push straight down on the left side, and I can feel that pain in my ankle when I do that.
So you're pressing into the quad.
Oh no, in the hamstring, the ball's here.
Oh, okay.
Right here. Yeah, but I can't show directly.
Oh, no, it's fine. I was just making sure I was understanding what you were saying. The visual is fine. So the deal is when you press into the calf, you're feeling that same referred pain.
Yes, on the left side of the calf, if I press there.
Yeah.
So
I would just work, it's the same thing as the shoulder. I'm just giving you tools to try to work on the soft tissue part. I think that the soft tissue component is probably exactly what you're having issues with, but to me, you're a more extreme athlete. You're doing things and like pushing your body, which also means that you need more opportunity to be able to do like self-care and rehab, essentially. You know, top level athletes have people who work on their bodies like this.
Yeah, I mean, I can probably do this each day after I run, right? A little bit, not a lot.
Yeah.
But
yeah. So the way it works, like, I think you could work on it as much as you feel comfortable with. You don't want to cause yourself pain. It's almost like, it's like getting a massage. Does it feel good? Cool. Is it causing pain and you're wincing? Okay, back off. Right now, just in that little bit I did, like this calf feels much more like spacious and open. But I didn't think that I had any particular calf tension. The same thing will happen. Your muscles, I think, will also get a higher level of performance. If your muscles are capable of relaxing, then they're capable of contracting at full force when you want it to.
Okay. Yeah. That makes sense. Yeah, I did feel, you know, that this can help with my hamstring more than anything else I've found as well, because foam rolling the hamstring is pretty tough for me to put enough pressure. So I'm going to use this and attack both at the same time. So that's useful.
It also depends on what you're working on. The hamstrings, just to give you like another quick option, I'll change this just to show. So if you come along, it's like, am I working on the calves or am I working on the hamstrings? And I've got enough mobility here. I feel this more in my calves, but this is broader than the tennis ball. Like this is really, like, I can feel the compression on this is so deep in my calves. I can feel my feet start to go to sleep because there's enough compressive force around my foot that it's forming like a tourniquet. So like my feet will probably go super pale. And then as I back off, like blood flow will just like flush, you know, back into my foot. There's also no issue if I've got this down, just to give you options. You know, if I got the leg out straight, you know, can I start to like roll into the hamstring itself? Oh, yes. Oh, right in there. Get it from another angle. So I'm using my hands to kind of balance so I can apply pressure there. And it's like, is it closer to the knee or is it higher up? I can also, just like we did before, you can start to balance on one leg and try to put pressure on just one hamstring. Same basic idea. You're just working a different muscle group.
Okay.
Yeah.
And I guess as far as the feet, would you just stand on the ball or?
So one of the things that I love personally, and I used to do this all the time in my yoga classes. Let me bring up the close up again. I'm going to do this with my right foot. So I'm on padding. This has a little give.
Mm-hmm.
But normally what I would do is on the floor. I don't want to lose my balance, but I would come, and what I do is I call it putting the heel down and then stepping on the gas. When I put the heel down, I've got more balance instead of just taking it and like doing this and rolling around. If I put the heel down, I can then come in and start to massage the plantar surface of my foot.
Okay.
I can massage that underside, and I can show some of the complexity here. Tons of muscle. That's the plantar surface, the underside of the foot, what we're pressing into. And then the bony structures are exceedingly complex. You have muscles that connect to all of that to be able to control all of those micro movements that your foot makes.
Interesting. Yeah, I never had foot problems in all my years of high school cross country and running on my own time in college. I never had issues until I really pushed it that 1 month.
Yeah. So for me, what I would do is, like in my yoga classes, is I would take the people and I would put them in mountain pose,
Mm-hmm.
you know, line them up for mountain pose, and then I'd have them work on one of their feet, and then I'd put them back in mountain pose, and they were always like, "Oh my God," because their sense of their right foot is like completely different after they've used this to basically massage the bottoms of their feet.
So I wanted to ask, when I'm doing this self-treatment, all this stuff we've gone over, do I have to worry about nerves and things like that?
I don't think you have to worry about it so long as you're not causing pain. And when I say pain, you're pushing yourself past what your body can comfortably take. When I do this and I go, ooh, right there, what I feel is if I pressed harder than this, my muscles would start to tighten to protect me. And as long as I don't overwhelm my body goes, oh, it's safe. And those muscles relax and let go. That always seems to create a sense of spaciousness. It feels like I get more blood flow. That's how it feels. I'm not sure that that's medically correct, but it just feels like my feet are more open. So I don't even have major issues with my legs.
Okay.
I use my legs all day long working on clients. But the thing is, the way my feet and my calves feel right now, I'm like, wow, I actually had tension there. I didn't know that.
Interesting. So if you don't mind, I just remembered something, another issue I had that I forgot to mention at the beginning. I sprained my ankle.
Yeah.
And maybe some other people have had this I think it was high ankle sprain. I never, got an MRI specifically for that incident, but I was playing basketball, which I'll never do again. And went like this.
Yeah.
Sprained my ankle. And the muscle I seem to have a problem driving. I do like to drive, and I have issues with this muscle. I forgot what it's called.
Tibialis anterior.
Yeah, so this tightens up. It always did in the past, but never really from driving. So from driving, I have pain along here, like this, almost.
All right. So just for the audience at home, so they get a better idea, that's tibialis anterior. Tibialis anterior causes a huge amount of pain for people down on the inside of their ankle. Like I see this all the time. The person will come in and essentially they'll say, hey, I got this pain. And I'm like, where is it? And it's like deep in my ankle or like kind of down on the front of their foot over here. 9 times out of 10, they're having an issue with the tibialis anterior. and I have to be able to put pressure in that. So I'm going to show you a way of working on it. We're going to go into the peroneals as well. The peroneals are a little more to the outside instead of this one to the front. The tib anterior, my tibia is right there. That's bone. This is on this side where it's fleshy, right in there. And I can go like cross fiber to be able to press. And what I'm going to do is I'm going to bring a blanket out, and I'm going to see, can I come in and like, oh yes. So what I'm trying to do is I'm trying to hook. Let me change the angle again. I'm trying to hook this front portion right by the tibia. I'm trying to lean that down on the tennis ball. Oh, now once I'm down like this, the tennis ball is there. I can essentially come in with my forearm and press into that muscle. And what I start to feel is that like referred pain down over here. Some tightness in the muscle there. And that's where I'm pressing, right in that biggest, thickest portion of tib anterior. Now, for me, the thing is, for some people, this might be enough, hands-free. That might be enough to get some work on that. Like I can press into it repeatedly, or I can maintain like a static pressure. For me, I actually like using my forearm to push down into the tennis ball. I'm getting that little bit of like this phantom kind of pain over here. How are you feeling?
Yeah, I can feel it on the top of my foot. And that was actually a big problem after I sprained my ankle.
Yeah.
That I had top of foot pain. For example, putting my shoes on kind of hurt if I didn't untie them first, you know, when you shove your foot in there.
Yeah.
That would hurt a lot. So I could feel it referring. And does it refer to the inside of the ankle?
So normally what I find, and there's some variability, but they'll get referred pain. Usually I've had people tell me this is one of the first muscles that I ever discovered like a trigger point in, if you want to call it that. And I had somebody that they felt pain in the bottoms of their feet. But here's what was happening. That tibialis anterior was basically grabbing onto some of those foot bones. And I guarantee you what was happening was that tibialis anterior was pulling that foot bone out of position. It was like this keystone. Once I released the tib anterior, the rest of her foot could function normally, and she went back to completely normal. What I had been doing is pressing in the bottoms of her foot. That's not where the problem was. That was just where she was feeling the pain. When I would get into here, because I did this almost brutal. I mean, this was when I just started working, 18 years ago. It was pretty brutal, like the amount of pressure I was using on the bottoms of her feet because I was trying to help her in pain. And then I was like, nope, that wasn't it. We did a session. I can't brutalize your feet that way. Something else is going on. So I started, instead of looking at the foot, started looking at the leg and went, whoa, what the hell is this? Like, this is really, like, you could feel it was just super, super tight. So when I started placing pressure here, she was like, that's it. And I'm like, where do you feel that? And she's like, I feel it in that spot in my foot, at the bottom of my foot. So the thing is, I just had to figure out which muscle it was so I could deliver pressure and then show her how to work on it.
Okay, great.
Usually out here in the top of the foot. That's the only case I remember where she felt it in the bottom. But usually if tib anterior is the issue, they'll feel it in the ankle and then towards this top outside of the foot.
Okay, great. Yeah, I mean, that's great pressure. So yeah, I didn't, it's definitely works for me.
Yeah. So just to check, and the thing is, when we talk about the feet, all of these muscles that wrap around the lower leg are attaching to bones down on the tarsals and down on the foot. So there's all these little tiny muscles, right? It's soft tissue. Anybody can have an issue with anything. It's always a challenge to try to figure out exactly, what the problem is. A lot of people will also have issues with their peroneals, and the peroneals are on the lateral compartment of the lower leg. they deal with a lot of stability. You can see Peroneus longus, brevis, and tertius. And one of the things I find interesting is the Peroneus longus is the fibularis longus. They changed the name recently. Fibularis longus, that the blue and the red, those are the same muscle. But Peroneus longus or fibularis longus is the big guy. Do you see how it wraps down around the ankle?
Yes.
Yeah, so it's like people can have weird pain like on the outside of their foot or like the underside coming from these muscles. And part of the challenge for like a massage therapist is because these muscles are in a lateral compartment, if the person is on their back or on their front, they have to come in from the side, which is like a weird space to deliver pressure. The way that I have people work on this is, again, with our old trusty tennis ball. And because it's in a lateral compartment, what I do is just like before we were in the front, we were in the tibialis anterior. Now I want to come in a little more lateral.
Okay.
And what I'm going to do is I'm going to bring my leg to the side. And what I'm doing is I'm stacking my leg over that tennis ball so that, again, holy moly, so I can lean right in. I'm going to change the angle again so you can see this. So I can lean right in. I can press on the tibia right here at the calcaneus, right at my ankle bone, and I can press on the thigh to try to press it down. And I get this crazy referred pain right on the outside of my foot. Kind of just, it's not really in the foot. It's more like in between the ankle bone on the outside and the foot itself, like this little phantom kind of thing.
Does this look like the right area?
How's it feel?
I'm trying to see. Does this look like the right area here?
So here's what I want you to do initially. I want you to go higher, which is I want you to go up a little bit closer towards the knee. There's no reason you can't work down here as well. You can see where that tennis ball is, but you don't have as much tissue right here. If I go higher, this is real fleshy. This is fibularis longus. I'll show that again here in just a second. Because you can see that big red on the right side, the fibularis longus. That guy is the one I'm trying to get to, that big thick section. That's the safer spot to be able to press in. So I'm up here and I'm going to try to put the tennis ball into that.
Okay, I found it. I think.
Yeah.
It's that pain I talked about
at
my ankle. I guess the other side like this here.
Yeah.
I feel that extremely tensely.
So I get this thing, it like wraps around the outside of my ankle bone. Like I'm getting this referred pain that refers right around the outside. Now I can kind of push that way. I can pull in. I can move different directions. I can also move down the leg or up towards the knee. So long as I'm not pressing directly on bone, soft tissue is what I'm trying to address. So anything along this lateral compartment, I can press in relatively safely. Again, it's that thing about pain. It can be intense, but my body isn't telling me to like contract muscles to protect myself.
Does moving my foot up and down help in this case as well?
So in my case, and this is me, I find athletes really like this, but I get more benefit if I come in and find that spot, and that's lateral. Oh, okay. Oh, okay. Then what I do is I can press in, but I'm going to take my foot, and hopefully you can see that.
Yeah.
Oh, and I start, so it's like I plantar flex, I dorsiflex. I'm like moving it around because I'm trying to get a sense of like the movement that muscle causes to be able to lengthen and shorten it.
Okay.
And work through it actively. I find that I get more nuance, more specificity by doing that through the peroneals.
Okay. Yeah, if I get up here, kind of like there.
Yep.
I can feel, sometimes I wonder if I need to be careful of if there any nerves there, but you're saying, I mean, is there any way to tell if I am hitting a nerve or something like that?
So here's what people will feel. And for other people, this is kind of freaky. Okay. they'll feel numbness and tingling.
Okay.
Usually in the order of like you press on something, you feel tingles, then you feel numb. For some people, that kind of freaks them out. For me, that's another day at work.
Okay,
Like,
so I don't need to
it
worry
happens
about
all
that.
the time. The thing that I want to avoid is pain. And
Okay.
I don't mean intensity, because I've had intensity, like pain is right here, intensity is right here, and I've had yeah.
Yeah.
And I breathe into it, and it's like, no, we're fine right here. And for some reason, that's what feels most engaged in my nervous system. That also seems to be what helps me release and let something go more rapidly. It's also why the sessions I perform seem, in my opinion, and experience, to be able to help people out of pain more rapidly. The people are coming in for a soft tissue treatment for pain management. They're not really coming in for a massage. Does it make sense?
Yeah, definitely.
Yeah. Like I've got a drummer coming in later this week, and he's describing some shoulder thing, and I'm like, I think it's your anterior scalene.
Yeah, probably.
And I'll see when I work on him, and I should be able to film the session. But you start to recognize these pain patterns. So for instance, when you told me what you were dealing with, that's how I knew what anatomy to grab. Because I'm like, yeah, he's probably just having some sort of issue with the muscles around the lower leg that's influencing what's going on with the foot.
Mm-hmm. Great. Yeah. This is, so that's the whole, I forgot what you would call this side of the leg.
Peroneal.
This side, but I guess there's this here.
That lateral side.
Lateral, yeah.
Yeah, that lateral side. The peroneals. It was peroneus longus, peroneus tertius, and peroneus brevis. But they changed peroneus longus for whatever reason to fibularis longus. But those lateral compartment muscles, I see a lot of massage therapists skip those. And it's because it's on the side. So the best position for a therapist working on it is inside lying, which is kind of difficult for some therapists to drape. So.
Okay, yeah. Great.
Well, yeah, outside. So essentially, like we gave you a way of working the posterior chain, the soleus and gastroc. We gave you a way of working tibialis anterior, and then that lateral compartment with the peroneals. That should go a long way towards you isolating what the issue is.
Okay. And I guess one more question would be this here, I guess not lateral, the other side, anterior. Is there anything here specifically? Like I did have a spot. This is just the gastroc, right?
So yeah, if I'll show this real quick, and hopefully they can see this on screen. So the gastrocnemius, you can see at the upper portion that you're going to hit a piece of that.
Okay. Yeah, this
from the side, but also what they're hitting, I think, is a piece of soleus, again, from the side.
Okay. So for example, this I can feel in my hamstring intensely.
Yeah.
So that might be the here.
And then the way that I address it, again, like, because to be able to press, like I've got the tennis ball on the lateral side, what I do is come in, and I was showing you how to use your fingers like this.
Mm-hmm.
What I wind up doing is I want to minimize my hands. If I'm comfortable doing this, if my body is comfortable, I would come in and use an elbow.
Okay.
And then I'm able to, okay, right there. And I'm not pressing directly into the tibia. I'm really pressing on the flesh just to the inside. But I can take that and I can shear up towards my knee, or I can shear down towards the foot and like pick one feels. And I'm getting this weird kind of wraparound little thing right here on the foot, right on the inside.
Okay. Wow. Yeah.
Yeah.
That is really helpful versus my fingers, which can cramp up.
The reason I had you do this initially, sorry if that wasn't clear, is like I'm trying to give people a sense of like to feel what normal tissue may feel like. And over time, this is where they always ask therapists, like, how did you know to press there? It's like, basically I tell people I'm like a butcher, like steak, and I'm like, ooh, this is the tender steak right here. What's this?
Yeah.
Ooh, this is this is a stewing cut. We gotta cook this down. So you could find something that's more dense, tense, tight, and restricted. 9 times out of 10, that's where I'm going to focus. That's where I'm going to get the most benefit.
Well, I felt a slight release just now with my elbow, so that's really helpful. It's so simple. So I'll use that for sure.
Yeah. So if you get tired, like my body has to turn a little bit to put my elbow, I can come with the opposite side, but the twist on my spine is a little bit different. I just want people to feel comfortable as much as they can while they do it. There's no issue with like stacking blankets or whatever you have to do to like lift the leg into a position that makes it easier for you to reach in and work on that. Oh,
Okay.
eek. Oh. You still there?
Yep.
Okay.
Sorry,
Oh, you're fine.
I was getting a call.
So for the rest of your leg, the one thing we didn't cover, are you having any problems with your quads?
I maybe at the top. So this is
Do you have any
something.
issues with your knee?
Yeah, I have actually before. I guess the only thing I did know how to treat was my quads at home.
Yeah. How
But
were you working on your quads?
so I just do, I forgot what they're called. I know the VMO here.
Yeah.
I would use just the ball. That's the first time I used the golf ball, by the way, on my VMO. And
Yeah.
it was definitely the most helpful. I would use this and then foam roll after, or vice versa, to loosen it up. And then just, do the regular, like, use my arm to support myself and roll the outside of my quad and try to roll the inside as well.
Yeah. The foam rollers kind of get a bad rap. A lot of people talk about them, and I think what people are doing is they're putting pressure and they're just very aggressively rolling up and down. Whereas I use this more as like a soft tissue tool where it's like, yeah, I'll roll up and down to find something and then go, ooh, what's that? And then I'll try to stack body weight to like hang out on it. So for instance, when people are having issues with their quads, I see a lot of stuff with rectus femoris, which is right in the front, and then vastus lateralis, which is a little bit more lateral. When people say that they're having IT band pain, 9 times out of 10, it seems like their tensor fascia lata or their vastus lateralis is causing some of that issue. Does it make sense? And these are big muscles. The rectus femoris in particular, if people have problems with that, they'll tend to get pain right underneath their kneecap. Do you see where it feeds in?
Yes.
Yeah. So they'll get issues right underneath their kneecap coming from rectus femoris. What I have people do is I'll have them put the foam roll out, and then it really depends on where they have pressure, but I'll have them start on both because they can distribute pressure evenly, and they can kind of plank on their quads. Let me see if I get it from another angle here. They can kind of plank here, but once you've picked one, let's say it's my right leg, then I can stack. Holy moly, holy moly. Oh. Then I can also roll a little bit more lateral, and that's going to start to put some pressure right into that vastus, lateralis. Right through there. Like all these different angles. Now I can also switch from leg to leg and be able to put some pressure right in there to be able to hook. I can control the angle to be able to press. That's pretty big and broad when people are getting started. It's just giving them a way of working in that area. And I can always go back to center, which in my case, the rectus femoris doesn't cause as much of an issue as that lateral compartment where vastus lateralis is.
Okay. Yeah, I did have 3 years ago extremely bad knee pain.
Yeah.
Where I had to stop running for 3 months. I didn't know, I had a feeling it was my quads, and loosening those up helped a lot. Yeah. I did have one more thing maybe that you'd have an opinion on. So I have like groin pain in my right leg.
Where? Can you describe it?
Like right here, like inner, like the iliopsoas is what I read would cause pain in this area.
Okay.
So I had pain there, and it feels almost like my right leg with how tight you talked about imbalances. It's like my right leg is almost shorter. Okay. So my left quad is bigger, and my right leg takes a lot of hits in the hip. So I thought what was happening was that my iliopsoas tightened up, and then it just cascaded and tightened up my hips and everything like that.
So
Have you seen that before?
a lot of people, COVID especially, people spend time at a desk. And what that is they're always bent at the waist. They're sitting at a desk. What I have a tendency to do, and I have a little more of an issue with this right leg. So I'm going to have the right knee down, the left foot forward, and then I'm going to come into this, this kind of stretching it backwards stretch. Now I want to feel comfortable in my knee, and I can also put my hands down if I need some additional support. I'm going to engage in just a little bit of movement side to side, so I can see if I can find, right. And here's what I feel. This big broad thing right up into that anterior compartment you're talking about. Right in, right into there. Now that's one way to access it, just by lengthening it, and it's going to pull right up into those fibers, right?
Mm-hmm.
The next piece is I have a little more issue with my TFL, which is kind of a weird spot because it's not right in the front. It's almost like a little to the side. Like my greater trochanter, my femur, there's this bony knob, but it's like right next to it. Golf ball. It's inordinately challenging. And in fact, I'm not going to get any pressure with this mat. So I'm going to actually half this. I'm going to pick up this edge and fold it up so I can show this real quick, because I had to work on this last night because I felt, are you ready? I had a little bit of knee pain, and the knee pain is right on the outside of my knee. It's right over here. I spent years, I'm a yoga teacher, body worker. I'm the expert, right? No, I'm not.
Yeah.
Like I had knee pain and I was like, and the thing is I had a small tear, a little piece of my rectus femoris or a little piece of my TFL. I'm not exactly sure, but it was just, it's kind of lateral. It was like hard to get to. And what I have to do is I have to position a golf ball and come in and like roll my body up on it. Now I'm not hitting my ASIS, my anterior superior, this is bone, superior iliac spine. I'm just lateral to it or beneath it, working on soft tissue. Intense is fine, pain is not. I would roll cross fiber, and I get that referred pain down into my knee, but then I could stack my weight to be able to lift my leg to like change the position that I was pressing into.
Is it near the piriformis?
No, that's more posterior. This is more lateral. So where I'm pressing, and I'll come up to the camera so you can get a little bit more of a close-up of this, is in my case, I'm on my TFL. I'm like right here. Do you see how it's not to the front? It's not to the side. It's kind of in between. I can roll to where I'm on my quadriceps. I'm on a rectus femoris. I can have some issues in here as well, but the ASIS is more right here. You can't really see that, but the ASIS is more right here. It's like a bony protuberance right here. I'm below that. I'm not pressing in my groin. I'm not pressing on my bladder. I'm not pressing around the pubic bone. I'm definitely on the leg right here, but there's no reason that you can't press. This is muscle. It's only when I get the trochanter, that's bone. It's only when I get the ASIS, that's bone. You're pressing in soft tissue and you'll feel more pressure in the soft tissue when, again, it feels intense, but not painful. But you can see, for me, because that TFL is kind of lateral, like I have to lay down and sort of position myself to be able to even get to that muscle. Your sound went off.
Hey, sorry. I was able
fine.
to recreate the lower, like inner groin pain by doing that. So I didn't. What does TFL stand for?
Tensor fascia lata.
Okay.
Yeah, tensor fascia lata. It's a muscle that's just this in its lateral compartment. So if you're standing like this, I can show you how to find it real quick.
Okay.
You can kind of see where I'm pressing right here. I can press back and forth and I get this cross fiber. I get like a little muscle and I'm going bloop, bloop, bloop. It's like popping over that.
Okay.
But you can see it's a little more lateral. It's not just to the front.
Oh, is it right by the hip socket, kind of?
So if you find your greater trochanter, there's a bony knob right here. People talk about their hip bone. Then go a little bit forward and then press back and forth. Because I find a muscle and I can feel the muscle. It's almost like it feels like my bicep, like I'm rolling over.
Yes. Okay. I think I found it.
In my case, my TFL, I think I had a little tear on this upper piece. So I have to lengthen it with that stretch. And then I have to use this to be able to get in there. It feels like a golf ball. I've had other therapists offer to work on it. They have a problem putting me in a position to be able to get leverage. This actually works better in my experience. And I can control the pressure. I can push myself just as far as I feel like I'm getting some intense engagement.
Okay.
Yeah.
That makes sense.
But if I'm using this, can I go into the front? Yeah. As long as I'm not hitting bone, like all of this is still fair game. You just go slow. There are very few spots that I would say, you know, just don't put any pressure on. And when I talk about soft tissue, 9 times out of 10, you're pressing on nerve, but you're also pressing on muscle. Like, do I press on bone? No.
Mm-hmm.
The bone is not going to release. Soft tissue, like muscle, ooh, muscle, ooh, muscle, ooh. Yeah.
Okay, great. That makes sense. And I guess there was one more muscle. So I forget which one. I don't know if this was the iliopsoas, if you've seen this before, but on YouTube, how the guy accessed it was he asked someone to lift their hips so they could grab the pelvis and push into it. Like, I don't know if that's the iliopsoas too.
So yeah, iliacus and then the psoas, and then they call it the iliopsoas. It winds up being like 2 separate muscles. It's a little more challenging. I actually prefer that people on their own just lengthen it. I find it really hard to like put pressure to be able to work on it myself. And once I have people putting something inside essentially inside their pelvis to try to get to that, you're getting to an area I don't want people to be afraid. I think there's more potential risk.
That's what I thought. Okay, so that's something you do in person then. Most likely.
The thing is, you can still access it. So for instance, think about it. Like I gave you a stretch and think about this just for a second. Is that stretch better or worse than applying pressure?
Probably similar.
And the thing is, it is similar in my opinion, because you're just accessing the nervous system. They're just different ways of providing a stimulus. Most people spend their day like this, so they're bent at the waist. Anatomically, that's like a weird, position. We didn't evolve to sit at desks necessarily. So going into a stretch to be able to lengthen that can be quite beneficial. And I can feel it pull down into my lumbar spine, down into my low back. I can feel it lengthen into the front of my rectus femoris. I can get a little bit of that tensor fascia lata in that lateral compartment. I get this real, sweet spot.
Okay,
but
I didn't realize
that's a safer way, because there's a big debate about iliopsoas work in the bodywork community and whether you should go in and like press on people's abdomen to access it. Now, I'm in favor of doing that, but I think it's harder to teach people to do it to themselves, and I probably wouldn't start with a golf ball.
Okay, that makes sense. I didn't realize that stretch was addressing that earlier.
So partially, yes. And that's what I'm saying. I don't want you to think it's less effective just because it's a stretch. Like I feel that in that anterior compartment where I have an issue, it's basically like, let's say I tore, this is the top of the pelvis. So it's the top of my TFL. I had a muscle tear. Let's make an assumption. This is the lengthy end down towards my knee. So if I come in and I stretch, and basically what I do is I stretch, right there. And I hold that and I let it go. It's a safe way of doing that. Does it make sense?
Yes.
Yeah.
Okay, that makes sense.
I don't ever, when people watch these videos, I don't ever want them to have fear. But the other thing is in my abdomen, how much pressure can I really apply on my own?
It's hard.
It is. It's more difficult. It's like, remember we went over the subscap and I was like, you got to work your hand underneath.
Yeah.
It's
And
another
I try,
area.
but
It's real hard to put pressure there yourself. You almost have to have like an additional tool or something you can lay down on.
okay, that makes sense. Perfect. Well, yeah, I'm definitely about to start trying this daily a little bit, everything we went over, and I can reference this video and I will definitely let you know how it's working.
Cool.
So I can know pretty soon, probably.
All right. Yeah, just keep in touch with me. Let me know how it's going. If you need like a refresher or something, I'll put these videos up over time. Did you have any other questions before we finish up?
No, that's it for now. If I think of something or, if I have any thoughts about how everything's reacting, I'll give you a call, let you know how it's going. So
Okay.
I think that addresses everything for now, the inner and outer ankle pain and the foot. So, and then my groin, those are the major spots as far as running goes that I was having trouble with. So
yeah. So the other thing is, I know that you're already very active. I'm a big fan and proponent of yoga. And when I say that, it's general. It's just using your body in space, exploring range of motion. You can call it range of motion exercises if that works better for you. You're already doing pretty high impact stuff, but you'd be able to just gradually just lengthen and create space in your joints to go back to what I think of as more anatomically neutral. You feel really nice, but when you're going and working out, you're shortening muscles. People don't spend enough time lengthening muscles and bringing their muscles back to neutral. Does it make sense? They're training their bicep to contract.
yeah.
Yeah.
I've been taking a break from, the high impact stuff until I figure some of this out. So I'm going to slowly reintroduce some running, but only when I've done this for a few days, and I'll know because, I've taken that break. So I shouldn't have any immediate pain and I can tell better if it's working, I guess.
Yeah.
So
cool. So listen, just keep in touch with me. I'm going to go ahead and shut this down here in 2 seconds. Okay. It was nice chatting with you. If you need anything in the future, just feel free to reach out. I'm happy to do like another consult or whatever. If you get a chance to come out to Austin to get a session, just contact me well in advance so we can work it out. But I'm just going to be essentially I would just be working on some of the same stuff, but you get much more of a sensation of like how it feels based on years of me practicing, like how to apply pressure.
Okay. Sounds good.
Cool.
Perfect.
Yeah, listen, I hope this helped you. And